Hi. First of all, thank you so much for having me here today. Many of you are wondering how I ended up here. First, I'm going to go backwards. I met Oded through Dr. Lenny Wexler, his daughter's oncologist, and he asked me if I would be interested in helping to review some cases from Israel of children who have sarcomas or rare tumors. And I said I'd be happy to. And so part of what I do is I work with Oded and My Child's Cancer is we review cases for families and for their doctors. It's sort of giving a second opinion to help patients feel more comfortable with what they're getting in Eretz Israel. In Israel here, they have phenomenal doctors. We do almost exactly the same thing that you're doing, and people feel like they have to run to America. And I just want to say that we're here to work with you and work with your doctors in order to help you feel more comfortable with what your therapy that you're getting here. But I have been extremely impressed in all of the treatments in all of the hospitals here in Israel. We also work with the doctors. We have an international tumor board where we review cases that are very, very complicated. They would be complicated anywhere in the world, not just here. But we're happy to provide resources for relapsed patients for clinical trials or for even just guidance on therapy from experience. We have multiple doctors from the US, and our next tumor board will include some European doctors as well as many of the Israeli doctors from the different hospitals. So My Child's Cancer is a unique organization in that it provides knowledge and empowers the parents to take an active part in their child's illness. And I think there's nothing greater than partnering with your physician and your local organizations in order to take care of your child. So I'm going to tell my story. I'm going to go a little bit backwards, similar to the first slide that we started with. In the United States, there are about 15,000 children diagnosed annually with pediatric cancer. The survival rate over the last 50 years has gone up from less than 10% to over 85%. And that's because most children are seen in institutions that are part of the Children's Oncology Group, the national cooperative group that takes care of children with cancer. And over 50% of eligible children are enrolled in clinical trials. So we can stand here today and say, thank God there are close to 500,000 survivors in the United States of childhood cancer. And cancer is not just one disease, as many of you know. The overwhelming majority of the children we take care of have leukemia, lymphoma, or brain tumors. And then the other group of tumors are the ones that I take care of, sarcomas, rare tumors, those make up the rest of the tumors. So when somebody says that their child has cancer, even if it's two patients diagnosed with leukemia 20 minutes apart on the same day, those patients, as soon as they start therapy, as soon as they get the genetics back of their leukemia, they're different. So your course in your individual journey is different than the person sitting next to you. And it's very important to remember that all of the side effects that one person had doesn't mean that every single person is going to have them. It's sort of like many of you remember that laundry list that the doctors went through when they told you all the side effects of all of the medications and tortured you through that first talk. That's not going to happen to every single person. So that's part of why we're here today, is to help you get through the survivorship period and to move on and to thrive through your journey. So up until the age of 11, I was normal. I don't know if I am anymore, but I was. I lived a normal life. I had I had two brothers. I grew up in Brooklyn. I had transferred into a new school for 6th grade, and I used to say I was a gymnast, but then I got caught. I took a gymnastics class, and I wasn't very good, which turned out to be a good thing. So instead of running over the horse, I ran straight into the horse that you're supposed to jump over, and then I started throwing up. My brother had a stomach virus, so everyone assumed that I had the same stomach virus. But 2 or 3 days later, my stomach blew up to look like I was 6 months pregnant, and he got better. So seemingly that wasn't the case. So I went to the pediatrician. He felt my belly. I remember him saying that there was a mass and that I needed to go to the hospital in order for them to figure out what was going on. So I went to the hospital, and in the hospital, they said that there was a very large mass around my ovary, and the tumor had ruptured and spread in my abdomen, and that I needed to have surgery right away. So as all good Jews in America do, we were in one hospital, and of course my mother transferred us to another hospital because you can't just stay in one hospital. And on the way from one hospital to the other, I asked my mother, well, what if the mass is cancer? And she looked at me and she's like, you're 11. And I said, so she said, if it's cancer, then we're going to deal with it. And that's really the way my mother went through the entire experience. She was extremely positive. She was extremely honest. She felt that God was going to send us messengers to help us get through this experience and to overcome all of these challenges. The first messenger was, she actually, when we transferred hospitals, we went to see her former obstetrician, the person who delivered me, and he did surgery, and instead of removing everything, which back in 1979 was the original plan, he only took out my one ovary with the cancer on it. And then, again, as all good Jews do, we transferred to a third hospital because you can't go to just two, you have to go to three. And we met Dr. Harris. So Dr. Harris, there's still no one in my life who I've ever met who's as wonderful, as tall, and as warm a person in the entire world. He really... I remember where I was sitting. I remember everything that he said to me. I remember him saying that the surgery had taken out the cancer, but there were cells that were floating around in my body, and he needed to give chemotherapy, medicine that would go throughout my body in order to get rid of the cancer cells. And at the end of the 12 months of chemotherapy that I would have another surgery to make sure that there was nothing left. He went over all the side effects. I'm assuming he gave my parents a more detailed conversation than me, but I do remember nausea, vomiting, mouth sores, being in the hospital, all of the details. I felt like he was telling me what was going on in a very age-appropriate way. And I just felt like that led... the way that everything went was, Dr. Harris and my mother, they talked to me in an open, honest way. My mother did tell me it was okay to cry together. My mother did focus on all of the things that were good. She was very much into the power of positive thinking and thinking what was, that all of these situations were an opportunity for things to get better. And so not one to pass on an opportunity. I said, what if I don't make it to my whole birthday? Could we have a half birthday cake? So I really like the ice cream cake. So that's me having an ice cream cake at my half birthday. But my mother, not one to get knocked down by my sense of humor at the time, really said, okay, we're going to have a birthday party and we're going to get to your whole birthday and there's nothing to worry about. We went to, at night when I wasn't feeling well, my mother took me out to clothing stores, and we would sit outside and watch the stores and think about what we would shop for and what we would do. I just remember it being an incredibly positive, fun time, which is a little bit strange, but I definitely remember crying with her. I definitely remember asking why this happened to me and didn't happen to other people. But I just remember her saying, this is what God gave us and we're going to get through it. I spend a lot of time talking about my mother. I don't actually talk about my father, but he is there. He's on the side. He didn't really, wasn't such an active participant in everything. He was very much the person who drove us to the hospital, waited outside in the car, and if he came into the hospital, he had to run outside to put money in the meter. There were no phones with apps back then, so he had to run out to the car. Actually, when I was engaged to be married, one of the doctors said, do you think your father's going to come to the wedding or he's going to wait outside in the car? So I didn't really understand why my father was not really present until he was much, much older. It was so hard for him and so painful for him to watch me suffer that he just couldn't be in the room. He could not handle it. He still, to this day, well, unfortunately now he has dementia, but prior to when he developed dementia, he was unable to talk about it at all. He really could not participate in any conversations, whereas my mother was always willing to go back and talk about it and relive the experience and be a part of it. He would even be upset when I talk about my patients. You could see him visibly just very sad for the families who were struggling or kids who were diagnosed. He just it was very, very hard for him. And I think that's very important, to allow each person or each parent their own time and their own way of dealing with things. And as a child, I didn't really understand, and nobody explained to me that that was okay. And I think when parents are on different pages, which sometimes happens even when the child doesn't have cancer, it's important to be able to explain to the child what's going on and why this is hard for daddy or why this is hard for mommy and why one parent seems like the champion or why one parent has to work and the other parent's in the hospital. Every child has a different experience, and you don't really realize how much your child is trying to figure out why one's there and one's not. Back then, there was no Zofran. There was really nothing except for like Ativan to make you go to sleep, so you didn't really have any medications for nausea. So my mother found an allergist who used to do self-hypnosis for patients. So I took it as an opportunity, and I charged admission for the residents, and I let them come and watch me learn how to do self-hypnosis. I also bought some pizza, you can tell by the oil stains, and I sold them at $1 a slice. And in 1979, I made a very nice profit off of my pizza. And the truth is, the hypnosis worked and cut my nausea down by about 50%. Back then, there were no support groups, there was no camps, there were no organizations that were helping people. So we had a lot of stuffed animals, and every single one of them, my brother helped me name them all. Each of them had a name, each of them had somewhat of a personality. He used to play with them. And they would get IVs, they would get stuck, they would have surgery, and poor Gumbo, the giraffe in the middle, he was a very important animal to me. And then I lost him, but I didn't really lose him. My brother hid him up in a chandelier and tortured me. He almost burnt the house down as well, but part of being normal at that point was being tortured by my brother. So I give him credit for inventing the play therapy, and I give him credit for torturing me as well, because you needed to feel normal. There was nothing normal about what was going on. I wasn't in school. My friends didn't understand what was going on. There was really no one to talk to. I was sitting with doctors and nurses talking about life and death, and they're worried about what their hair looks like and whether or not they're playing jump rope. So it was a very different experience, and not having normal peers around me was very, very hard. I did make it to my full birthday, which turned out to be a good thing. And then I went back to school. So at school, my mom had, the year that I was out, once a month, she took us into school, and basically the kids all enjoyed it because they got a free period, so to speak, and the school kept the other students engaged. Like, they would send cards, they would send letters back and forth. So it enabled me to keep a connection with the other people in my school. I always, though, laugh because I feel really bad for the other kids in my grade. They had this picture of like all of them that they bring home to their parents, and there's me in the middle with my little bandana. I refused to wear a wig back then. It took me a while now too, but I refused to wear a wig when I was younger. My first month back at school, the teacher gave us an assignment, which maybe she didn't get very good counseling when I came back to school. It was called My Biggest Fear. So I wrote all about how I was sick, and my biggest fear was that my cancer was going to come back, and I didn't know why I was chosen. And this was right before my surgery, so I was hopeful that I was going to live. And she's like, I'm sure you're going to do really, really well. But then she was so obnoxious. She gave me a B+. Can you imagine? Like, hello, I emptied out my heart here. So I think teachers didn't really know how to deal with me. They probably didn't know how to deal with me before I was sick also. But one of the teachers had an assignment where you had to say, who's your hero? And I got up and said me, because my mother and my doctor always said that I was a hero. And she's like, that's not what I meant. I still think she's wrong, but I think that any person who goes through this, that from the day of diagnosis, and we're just having a discussion, is when are you called a survivor, right? So are you a survivor after 2 years, or you're a survivor after 3 years, or you're a survivor after 5 years? You're probably a survivor after 5 minutes, because if you make it through that conversation and what the doctors are telling you, you are surviving. And the goal is to be somebody who thrives. You want to be able to move on and get through the situation. And when you go to school, all the lessons come first and then the tests. But in life, it's tests followed by lessons. So I think when you're in a situation where your child has cancer, or you yourself have cancer, you're learning all of these lessons, and the question is how to use them in life. And so when life goes on, you have to go from this confused, lost state of overwhelming situation, and you have to figure out how to recover, how to move on. And how do you take your experience and turn it into something that is going to sound really good on your college essay and really good when you make a speech 45 years later. So it's taking that situation and reframing it and making it something that you can use to move forward. There are some patients, I will admit, who will not say a word. They will hide their experience. I have a friend who had a sarcoma in his leg a year before I did. When I was sick, so in 1978, he still tells people that he was in a ski accident. He does not tell anyone. His kids don't know. So everybody is entitled to their ability to change things and to make it whatever story you want. I'm more like a billboard. Hi, my name is Carolyn. I have cancer when I was younger, and now I'm a pediatric oncologist. You know, it's usually within the first 30 seconds of meeting me, you say, hi, what do you do? And I'm like, I'm a pediatric oncologist. And most people say, why? And I say, why? Because really over 80% of our children are cured and go on to be long-term survivors. And even children who are not cured, they are the most amazing and resilient children and families, and that we are privileged to work with them and privileged to see a group of people who, even when life is so challenging, have moved forward and are moving forward through difficult times, but with incredible optimism and incredible resilience. And that's what we need to hold on to. So yeah, there are going to be very hard days. There are going to be very long days. But along the way, there are going to be little miracles that we each have. So although I had only one ovary, and although I had major surgery and lots of chemotherapy where they said that I wouldn't have fertility, I have my twins. And 15 months later, I have my son. So we are very, very fortunate to have gone on to have children. And so what's it like growing up with a mother who's a pediatric oncologist? So my children did not really have normal birthday parties. They made bake sales to sell baked goods to buy toys in order to give the toys for their birthday to the hospital. So they would, instead of having normal birthday parties, my children were active participants and partners in the healing for the patients, because one of the hospitals I worked in didn't have a lot of funding for toys for the kids, and I felt like it was an important teaching point for them that they are so honored and so privileged to grow up without an experience like this, but they're also so privileged to be able to see what's going on with these children's lives. In fact, they grew up going to Camp Simcha, Chai Lifelines camp in America. And I remember when she was very young, came back to the bunk and she was so upset. And I was like, what's wrong? She's like, those kids, they're getting so many prizes. I'm not getting anything. I'm like, they're sick. She's like, no, they're not. They're totally normal. And I'm like, she has one leg and she has no hair. She's like, she's normal. What's the problem? So it's such an unbelievable thing that they grew up looking at kids with cancer as normal, as their friends. And for me, having grown up as a kid with cancer and not having friends around me, it's such a privilege to watch them grow in an environment where they can consider patients who are struggling and families who are suffering as normal. We spend a lot of time going to family celebrations. The young man who's in between my husband and my son is now taller than my husband and actually has 2 of his own children. This is one of my patients coming to our celebrations. So not only do we go to their celebrations, but when you're the mother in the family, you actually end up bringing your patients to your celebrations. And it's really a very special part. In fact, I think when we go to the celebrations, I'm often like, okay, 20 minutes. And after an hour, I say to them, I'm like, can you guys get my husband out, please? Please bring my husband out. So I think it's just an incredible opportunity to be around people who are so giving and so loving and so appreciative of everything that they have in life. And whether the outcome is good or bad, it's not necessarily up to me. I'm just in charge of the process. I can help people through the process. God is the one who gives them the disease, and God is the one who takes away the disease. I just get to be there to help through the process and to participate in any way to get through all of the situations that our families deal with. So I always wondered, when I tell my story, what would happen if something happened to me when I got older. So about I guess it's now about 20 years ago, I developed scar tissue in the area of where all my surgery was, and I developed, we told the kids it was a bubble, but it was basically a small bowel obstruction as a result of the scar tissue, and I was in the hospital multiple times as a result of old scar tissue. And while I was sick, I was like, okay, so now I'm older. Am I still as positive a person as I was? I'd say the big difference is being part of a community versus what it was like when I was younger. People were bringing meals. People were coming and picking up my kids and taking them to activities. Nobody called and says, what do you need? People called and said, I'm bringing you dinner. I'm taking your child to school today. I'm taking your child to a birthday party. It just made it so much more concrete for me and for what I needed, because I didn't even know what I needed, but people were able to come and to help me. In fact, one Shabbos afternoon, I was in so much pain that I was lying on the floor in the bathroom, and I said to my kids, I will give you anything you want if you go down to the basement and play. And so one said, I want a piano, one said I want drums, and one said I want a parasol. My friend came to see me when I was in the hospital that night, and I told her the story. And then 2 days later, before I got discharged, she showed up at the hospital with drums, I'm going to choke up, keyboard, and a parasol. It just goes to show you, if you let people into your life and let them help you, you're not only helping yourself, you're really helping people around you, because people just want to give. They don't even know what they want to give. I tell families all the time, just appoint a point person. Tell everyone to contact that person and let that person be your point person. Let that person tell them what meals you need. Let them tell them, let them figure out what you need. Like, you have so much going on in the hospital, just focus on it. In the days of answering machines, I used to say, leave a voicemail. Hi, we're a little busy right now. We'll get back to you in about a year. But you can have one person just be the person that they communicate with, so you're not overwhelmed. There are people that are truly interested in helping, and then there are people who just want to know the details, and figuring out who that is, you can let your point person say, this person really is somebody good for you to speak to, and this person I'll take care of. It just really helps divide it up. So when unfortunately my mother passed away about 2 years ago, and I felt that while she was sick for a while, everything that I was doing was because she taught me what to do. Granted, being a doctor wasn't so unhelpful at the time, but as a doctor, which is a result of my illness, as being her daughter and being someone who knows how to be a patient advocate, I was really able to help take care of her in a way that I don't know that many other people would have been able to. It was really my honor and privilege to be able to care for her. After she passed away, I wanted to do something special in her memory. When I was done with treatment, there was a book called Closing the Umbrella from the American Cancer Society. It was all about going back to school, going back to work, how to relive your life. But it was really all about the patient, right? The patient goes back to school, they're running away, they're done, right? The parents, number one, they've been moving so quickly, they've had absolutely no time to process what they went through, because they were just going nonstop the entire time their child was sick. And now the strangest phenomenon for the parents is, what do you mean you're not giving my child any more treatment? What do you mean I don't have to come every week and I can come every 3 months, every 6 months, once a year? I like coming here. I've had families call me and say, I need to come in. I'm like, you don't need to come for 3 months. No, I need to come in. I haven't seen you in 4 weeks. I need to come in and see you. So the parents, it's a tremendous loss, right? The whole connection that you have to the hospital, the social worker, the environment, and the community, and no one gives the parents an opportunity to process. So that's why this symposium is so special, in the fact that they're educating you and helping you come together as a community to lean on each other and to learn more about what you can do for your children. But at the same time, I'm not going to ask you to raise your hand, but how many of you have taken time for yourselves to process what you've gone through and to deal with your own emotions? Because the more emotionally healthy you are, the more you'll be able to help your child, and the more you'll be able to enjoy your child as your child gets older. So we created a symposium very similar to this, and then in the afternoon we had some wellness sessions, more about things that you could do for yourself in order to overcome some of the things that you've gone through. And I really wish that for my mother that had been there. So that's why I did this in her memory. So the last part is why marry a cancer survivor. So these are my children, my in-law children, and my grandchildren. I would say that's a really good reason. They're very, very cute and very yummy. But also, there are some incredible things that survivors have been through. They've been through their own personal wars. They've really matured beyond their years, and they have incredible gifts to give over. So my other side job, besides my side job of helping with my child's cancer, I like to review resumes or shidduch resumes for people and help them figure out whether or not it's a good match. I've actually said no sometimes when some of it's too close for things in terms of survivors. I don't think that every person who's a survivor needs to marry somebody who has had cancer or has some other type of disability. I think our challenge is to turn any disability into an ability and turn all of our survivors into thrivers. And I don't really have any words to express my appreciation for all of you coming and for listening, and for My Child's Cancer for making this symposium for all of you. Thank you.
Caraline, very inspiring lecture, very encouraging. Thank you very much.